Let's talk about de novo mutations. Whenever I tell someone that they have a condition that is potentially inherited or genetic, the first thing everyone always says is, well, no one in our family has this condition. For instance, a lot of generalized epilepsy syndromes do have a genetic cause associated with them. Now, when people think genetic causes, they think mom or dad has the mutation and now you have the mutation. Well, that's not true. A vast majority of mutations tend to be de novo. What does that mean? Well, there's no family history or any hereditary history of the condition. In this specific case, they're looking at cancer. Basically, in this illustration, there is no family history of the condition. However, a de novo mutation is a mutation that comes into play after fertilization. On occasion, it can happen even before fertilization, and it can happen either in the sperm or the egg. Basically, we are made up of millions and millions of genes. If even one is coded incorrectly, it can result in a de novo mutation. These de novo mutations can be implicated in a vast majority of things. Like I said, this illustration specifically illustrates cancer, but this applies to a lot of genetically linked epilepsies and neurological conditions. So what does that mean for you? If you have something that might be inheritable, or you have something that is genetic, definitely do your genetics. However, if this is a de novo mutation, your chance of passing this on is less than 1%. So I use this to tell my patients with certain kinds of epilepsy syndromes that they should not be afraid of family planning. If this is something they do want, definitely see a geneticist and assess your risk.